Welcome to Interview Day for the College of Medicine. My name is Wendy Grant. I'm the Associate Dean for Admissions and Student Affairs.
And I echo the welcome. My name is Jeff Tallman. I'm a pathologist, and I also serve as Associate Dean for Medical Education.
We're going to start off by telling you a little bit about where our campus is situated. There will be an opportunity after acceptance to come and visit Omaha and our campus. Many of you know Omaha or have been here, especially if you're from Nebraska, but we think that it is a really fabulous place to go to medical school. It's not too big, not too small, plenty of opportunities, and basically any cultural interest that you have is available in Omaha. We obviously have huge, noteworthy sporting events like the College World Series. In the area around campus, there's huge development with lots of places to live and restaurants. And we think that it's an easy, affordable, safe place to live as you go through medical school.
One of the best ways I've heard Omaha described is the best of both worlds. And I really think that's appropriate in the sense that it's big enough that there's stuff to do. We have a major arena that brings in music acts and big events, as Dr. Grant alluded to. But it's also small enough that it's easy to traverse. You can get across the city from one end to the other in a half hour, even during rush hour, putting rush hour in air quotes. And it's easy living, as Dr. Grant mentioned. Cost of living is great, and it's a great place to learn.
We also are very proud of our campus, and there is ongoing development all the time. There's lots of outdoor space and indoor space. The library has tons of areas for you to study, both by yourself and with groups. The main place where our students spend a lot of time during the curriculum is in the Sorrell building, which is across the street from our main clinical partner, but also surrounded by the College of Pharmacy, College of Nursing, College of Public Health, and College of Allied Health facilities.
The College of Medicine is part of UNMC, one of the 4 campuses of the University of Nebraska system. We partner very closely with Nebraska Medicine, the healthcare system, one of the largest in the state, and that's where most of your clinical training will occur in the later phases of the curriculum. As you can see from the mission statements here, which I'm not going to read for you, they are very closely aligned and focus not only on improving the health and well-being of Omaha in particular, but also the state of Nebraska as a whole. And that is something that is infused into everything we do within the curriculum, everything you will learn and do while you are here.
We are very proud of our accomplishments, not only on the academic side, but also on the clinical side. We pride ourselves in focus on primary care, and also our partner schools, the College of Allied Health, the College of Nursing, College of Pharmacy, and College of Public Health, all of which make up UNMC, are highly ranked and recognized on a national level. Nebraska Medicine, also our main clinical partner, is one of the leading medical centers in the state of Nebraska and is nationally recognized for its excellent care.
One of the key components of learning that you will have while you're here is the opportunity to learn about how to consume and perform research. And there are innumerable opportunities for you to participate in research here at the College of Medicine throughout your time, to the greatest degree that you wish. In fact, just as a kind of a statistic, about 85 to 90% of our students do participate in research projects while they're here in some way, shape, or form. These may be a part of formal programs that are run by the college or individual departments, but also ad hoc things that you may come into contact with as a result of just talking with faculty members. We do have some active summer research programs that occur during the time between the first and second year of medical school. And you can see that we have quite a few full-time investigators that run the gamut of specialties and domains within healthcare and the related foundational sciences. And you can see this is supported by a very, very large graduate college with numerous graduate students and postdoctoral research associates.
And I think one of the things that is important to remember about research is while your exposure prior to medical school may be mostly in the lab, in the basic science with mice and pipettes, the bulk of research or other quality projects are really focused on clinical initiatives and clinical developments. And so therefore it really can parallel very nicely with your learning as you progress through the curriculum. One of the things before we get into the nuts and bolts of the curriculum is that we think that your wellness is very important. This is a UNMC initiative, but also specific to the College of Medicine. We have an assistant vice chancellor for campus wellness, and there are lots of interprofessional activities that you can be a part of, and these are not only with students from the other colleges, but also employees from Nebraska Medicine, Children's Hospital, and other healthcare facilities in Omaha. A couple of the highlights include the Nebraska Medical Orchestra, which brings incredibly talented musicians, and actually you don't have to be quite so talented, but it's really fun to be able to sit beside a faculty member and participate in creating incredible music. We have lots of opportunities for reflective writing, teaching kitchen, and basically any student who has an interest and wants to start a group is welcome to do so.
There are innumerable student groups as well as other interest organizations that you can take part of, both made up only of College of Medicine students, but also from individuals from all the other colleges, which represent a nice interprofessional educational opportunity. Many of you come from undergraduate training with a host of extracurricular activities, so to speak. Those things were very important not only to get you to this point, but also to help you develop as a student. And we strongly advocate and do everything we can to support you continuing to branch out into those efforts as well, because not only does that help your wellness, but it also makes you a more well-rounded physician when all is said and done.
And one of the things that I think these opportunities give you is that when you apply for residency at the end of medical school, not to jump to the end before we even get to the beginning, but our students pursue things that, as Dr. Tallman said, really help balance who you are. And there's maybe a little less box checking as you move through medical school. It is really important to find things that you are passionate about to help remind you why you're working so hard to get to your end goal of graduating from medical school. We have a specific space in the Sorrell building for our medical students. It's a place for students of all years to gather. And we also have a wellness intern program where fourth-year medical students act as resources for the first, second, and third-year students. They have a very unique perspective, obviously, because they have just been doing what you will be doing. And we think that this offers a great place to gather, share your stories, get perspectives, and really, again, help you understand how the process works and how you can see things at the other side of the curriculum. We have been working very hard to make sure that there is representation throughout the curriculum. As our office has developed, there has been an in-depth look through every aspect of the curriculum. We do think that community engagement is a very important part of your education, and this is being integrated throughout the curriculum.
To build upon one of the things that Dr. Grant emphasized, we understand that to take care of communities, you have to be able to understand the diverse nature of the populations that you're going to see. And so a great deal of effort has been invested in ensuring that we are teaching not only cultural competencies so you can meet patients where they are coming from, where they are at, and to be able to provide the best care for them.
Our Office of Student Affairs provides career planning and support throughout your medical education. Basically, the associate and assistant deans in the office redo medical school with you on a daily, weekly, and yearly basis. You will meet with the leadership on an annual basis to make sure that you are on track to accomplish what you want. At the end of medical school, the office prepares a letter that represents what you have done throughout your time in medical school as you prepare for your residency application.
One of the key points of advising, and you will meet many advisors while you're here on campus, not only the faculty members that you connect with and try to emulate, but also career advisors and academic advisors. And you see here the four main academic advisors that we have. Their titles are directors of academic advising. Their job is to help you in the transition from your undergraduate and graduate training into medical school to help you succeed scholastically, as well as to be able to perform well on standardized examinations and everything that comes. You will be assigned to one of these individuals when you arrive, and you actually meet with them right away during the orientation and or first week of classes to get to know them, to get an understanding of what your study skills are, your preferences, and so on and so forth. They are always available for you to have conversations with. If you are struggling, we actually help facilitate meetings with them to help identify things that you can improve in your study skills or test-taking habits or whatever. And they work very closely not only with the Office of Student Affairs, but also with the Office of Medical Education. And they are present throughout all 4 years as needed. Each of these folks is a physician, so they have been through what you have been through and have special interest and training in doing the skills that I just talked about.
We also have a robust tutoring system available for you. The bulk of the tutoring is done by fourth-year medical students. Again, fourth-year medical students have just been through what you will be embarking upon, and we think that it helps to give some perspective of how to learn, how to study, how to digest all the large volume of material that you will be facing and learning as you go through the curriculum.
So, getting into the nuts and bolts of the curriculum, which is why we're here today. We call our curriculum the Training the Physicians of Tomorrow. This is a model that we adopted in the fall of 2017, so we've been doing it for a while. And essentially, you can read here the mission, again, aligning with the mission of not only UNMC and Nebraska Medicine, but the College of Medicine specifically. The content that we teach centers around 8 domains or main objectives, and these are the things that a undifferentiated provider entering residency needs to have basic knowledge and skills in, and you can see them here. But things to highlight from this list, everybody understands that medical knowledge and patient care and clinical skills are important. But systems of healthcare is something that the new curriculum spends a lot of time integrating into its teaching. This is learning your place in the ecosystem of the healthcare environment, understanding how the systems work, again, to best advocate for your patients as well as your colleagues.
And I think one of the things that's important to look at and understand as you think about where you want to go to medical school and how you want to learn is that it's not just about the medical knowledge. It's really about the whole system, the patient, you, your colleagues, and that's why we have multiple domains and objectives for the curriculum. I'll give a high-level overview. Basically, we have 3 phases. The first 3 semesters of medical school, learning really the foundational information that you need to be able to be successful in the clinical realm. The second phase is 12 months of required experiences in some core disciplines. This is really, a lot of times students sort of look at this as what they've been waiting for, why they went to medical school. We often hear students comment that, well, it would be much easier to do phase 1 if we had phase 2 before that. However, the goal of phase 1 is to get you ready so that you are not just shadowing or watching, but you really integrate yourself into the clinical team, take care of patients right in the weeds with learning how medicine works. And the phase 3, which is your last 13 months of medical school, is a time for you to really hone your skills, grow as a soon-to-be physician, and get yourself ready for residency.
One of the designs of the new curriculum, if you look at how the 3-phase model is laid out, is you'll notice that in many medical schools, the preclinical phase of the curriculum is 2 years, and we've condensed it down to 3 semesters. The reason for that is that we actually are giving that time back in the 3rd phase for career exploration. This provides you an opportunity to sample various specialties, to kind of have a better idea of what you're interested in going into before you begin the residency application process. The other thing that we concentrated on in the design of the 3-phase curriculum is transition points between the phases specifically. And I think that's been one of the major successes that we've had since instituting the new system. This includes the transition not only into medical school, the orientation onboarding process, but the transition from the preclinical to the clinical environment, as well as the transition out of medical school into residency. There's actually, we'll talk about it a little bit more at the end, but there are specific courses designed just for that. Running through the phases. Phase 1, Foundations of Medicine. As we've mentioned, this is 3 semesters in length. There are a series of 12 blocks. These are integrated blocks, meaning in other words, you're not learning course content across, for example, a course in anatomy, a course in physiology, but you're learning things in an organ system-based manner. These are the blocks that you can see as they're laid out, and you can see that they are organ system-based. So in those, you are learning not only anatomy and physiology and biochemistry and all of the things related to that, but also pathology and disease processes and pharmacology. Again, that helps you kind of pull all of these things together in an integrated fashion. You do have a couple of break periods during this. So between between the second and third semester, there is a summer break, and then there is a break after the third semester between the preclinical and clinical phases.
As we talked about, going through medical school is not just about relearning the Krebs cycle or understand how hepatocytes work or nephrons work, but it's also learning all the other things that you have to know to be a successful physician. And these are coils that are interwoven with the integrated blocks. Inquiries, how do you ask a scientific question? How do you answer a question that you may have? Ultrasound is a very important part of day-to-day medical care, and each block will have opportunities for you to learn how to use ultrasound. Physical exam skills, communication skills, these are all interwoven as you move through each phase of the curriculum.
The coils also move through all three phases of the curriculum as well, and they're not only interwoven but also progressive. So, for example, in phase one, in each of these various coils, in fact, they may be embedded to the point that you don't even realize that's what you're learning at the time. But as you progress through the curriculum, you get more and more exposure, more and more comfortable with the concepts in there, starting with an introduction in phase one to seeing application in phase two, and then enhancement and enrichment in phase three in each of these.
We think it's also important that you get into the clinical arena as soon as possible. After you get through your first semester, which we think it's very important to focus on learning new skills, how to learn, getting to know your classmates, understanding how to balance the workload that is required for medical school, and maintaining your wellness and exploring other things that help keep you balanced. The longitudinal clinical experience starts in the second semester and goes through the end of the third semester, where you would spend a half a day in clinic with somebody. As you spend more time working with a physician, you get more and more involved in taking care of the patients. And by the end of this experience, most of our students are going in to see the patients independently, report to the physician, and really participate in the decision making. And this all happens before you start in the focused clinical experience of the curriculum.
These experiences also tend to be energizing. They remind you, after being in class and small groups and labs all day, of why you're doing what you're doing. You're actually getting an opportunity to see patients, care for patients, because you are participating as a medical student at that time. But also provides an opportunity for you to practice your clinical skills in your interviewing, to apply the things that you're learning firsthand. And many times the preceptors that you're working with in the longitudinal clinical experience, when they know what you're in at the time, they will actually be very focused in the teaching and make sure they point things out to you to really drive home the points that you're learning in the remainder of the curriculum.
After the first 3 semesters of medical school, you have 2 months of dedicated time to prepare for step 1 of the boards. Like it or not, we have to talk about boards, because in order to practice medicine, you have to be able to get a license. And in order to get a license, you have to pass these exams. As most of you probably know, step 1 of the 3-step board process is a pass-fail exam. We give you 2 months, as I said, right before you start phase 2 of the curriculum. This is another opportunity for you to work very closely with your academic advisors in preparation for this. And we are very proud of our students that we have a pass rate that is at or above the national average.
So moving on to phase 2, the core clinical experience, as Dr. Grant alluded to. Actually, the beginning of phase 2 is a course called the Acute Care and Clinical Transitions course. This you encounter after taking step 1. So you have basically all of that done. And now you're able to focus on preparing to enter the clinical environment. And in that acute care and clinical transitions course, you're learning about special populations, dusting off your interview and physical diagnosis skills, as well as learning some basics about how to handle various presentations of common illnesses. For example, how to approach a headache, how to approach abdominal pain, things like that, intended to get you ready to go day 1 when you are in the clinical environment. There are 6 core clerkships that you will all do in some various order. It varies based on your preferences as well as scheduling needs of the college, and they range in length from 6 to 12 weeks. You can see them listed here. But bottom line, everybody participates in all of these. These are all required to go through.
We think that exposure to these core areas of clinical medicine is incredibly important for you to not only understand what's involved in these specialties, but also to prepare you for whatever you're going to do. If you're going to be a pathologist, it's still really important that you understand how to be a pediatrician or how to be an obstetrician or how to be an internist, because it gives you the perspective of how disease process affects the patients. And so when you're making diagnoses under the microscope, for example, you still have this clinical relevance.
One of the goals of the redesigned curriculum was to actually get students into the clinical environment more quickly. And usually, traditionally in medical schools, the semester has started in July. We actually have folks entering the wards on April 1st. We think this is very, very important to give you that expanded time for career decision in phase 3. But also it's shown that the compressed curriculum and the transition planning that we have done with the acute care and clinical transitions course and other things within phase 1 has been successful, because our students do very, very well with the transition into the clinical phase of the curriculum. So the third and final phase, we call it the career preparation phase, or phase 3. It is designed to do what its name says. It's designed to help you top off your clinical skills that you have learned in the prior 2 phases, as well as to sample specialties to decide what you want to do as a future career. Most of the phase 3 is elective, meaning that these are opportunities that you get to select to, again, explore careers, also to maybe do things that you've always wanted to try that you have an interest in. Maybe, yes, I'm a pathologist, but I've always wanted to learn more about dermatology. It's just something I wanted to learn more about. Well, you have an opportunity in phase 3 to do that.
Ultimately, if you want to practice medicine, you need to do a residency in the specialty of your choice. Each specialty has unique requirements for you to be successful in matching into that. We have career specialty track directors who will help you prepare in conjunction with the Office of Student Affairs. In March of your 4th year of medical school, there is a national match process. Most of you probably have heard of this. Every year our students are very successful. Our students go all over the country. We have about 40% of our students who stay in Nebraska, which means 60% of students go anywhere else in the United States. And about 85 to 90% of our students get one of their top 3 choices in residency spots.
To expand a little bit upon the career specialty track directors, as Dr. Grant mentioned, each specialty that you can match into has an individual identified. These people actually can begin career guidance and discussions as early as the very, very beginning of phase 1. If you think, hey, I may be interested in neurosurgery as a career, what do I have to do? What is this career like? You can cold call these individuals, and they can help provide guidance in concert with the Office of Student Affairs and your directors of academic advising, and help you along that path. And these individuals are available throughout your curricular journey, but more specifically, they spend a lot of time with you in phase 3. And part of the reason for our success in the match has been I would say, individualized advising that not only the Office of Student Affairs gives, but also these career specialty track directors who are in the departments and know what's going on the national stage. One thing that you also have an opportunity to participate in while you're here is something called EMITs, or the Enhanced Medical Education Tracks. These are always ever expanding, and you can see a list of them here. What they are, it's an and to the curriculum. So if it's an opportunity to enrich yourself in things that may interest you. These are by no means required. About 30 to 40% of our class, each class takes part in these. But what they actually do is let you get additional training in these various areas that you can see laid out in front of you. Also, students have an opportunity to participate in an honors thesis. Now, that's separate from the EMIT program. You can use your EMITs to maybe launch into an honors thesis, but it's another way to, both of these represent key ways to differentiate yourself and to show your achievements when you're on the residency interview trail.
And as you can see, there's a wide variety of EMIT programs. But one of the things is it gives you basically 3.5 years to integrate yourself into a healthcare team. And so often this may be some bench research, some clinical research, but also clinic time, focusing on a specific patient population.
Each of these exhibit tracks has a project associated with it, so it's kind of, I would say, built-in project and research. Also, you have a self-identified mentor there because each of them has a leader or leaders, plural. Again, these are not by any means required, but they represent an opportunity if you're interested in further enrichment.
As we talked about earlier, there are innumerable opportunities for you to get involved in the campus community outside of the curriculum. This list is not exhaustive. We think that if there is anything that you are interested in doing outside of the curriculum, there is no reason that you can't start an organization or join an organization, working not only with students from the College of Medicine, but also students from the other colleges at UNMC. We think that points of time for celebration of your accomplishments are incredibly important. At the beginning of medical school, we have a white coat ceremony where we welcome you to the profession of medicine. Match day is a day where you obviously all come together with your classmates and your families to find out where you will be spending the next few years of your life. This is a very unique part of medicine, but it works, and it's a great celebration. And then commencement at the end of medical school, when you finally will be called doctor, is an incredibly important celebration. It is a great opportunity for you to celebrate with your classmates and your family and look back on all of your achievements. We hope that this gives you a foundation of knowledge so that when we meet with you on interview day, you can ask us any question you want. We think that it's really important that we share who we are and that you have a good understanding of what our priorities are and how much we focus on getting you to be the best physician that you can be.
Hopefully one of the things that also came out in this presentation is how proud we are not only of our institution, but also of our students. And we're incredibly excited to have the opportunity to talk with you during the interview day and share additional thoughts and answer any other questions that you have.